Eating disorders. The term eating disorder covers a range of unique mental illnesses. Their main characteristic as a group is that they cause some type of harmful food-centered behavior. Behaviors vary but most often include food restriction or excessive eating. Eating disorders can lead to harmful physical effects and even death. Eating disorders included anorexia nervosa. Experts consider anorexia nervosa to be the most deadly of all mental illnesses because it has the highest mortality rate. For this reason, we can consider it to be the most severe of the 12 types of eating disorders. This condition involves severe food restriction and sometimes extreme exercising and other purging behaviors. The individual will typically show these signs and symptoms. Intense fear of gaining weight, even small amounts, are intolerable. Losing weight rapidly and consistently staying underweight. Their skinny appearance can be alarming for friends and family. Refusal to acknowledge that such a low body weight can have harmful health consequences. Amenorrhea. This is a term for when women stop menstruating due to low fat content. Heart damage. Anorexia stresses the cardiovascular system and can lead to a variety of life-threatening heart conditions. Bulimia nervosa. This condition, bulimia nervosa, occurs when someone is repeatedly binging on large amounts of food and then purging it. Purging behaviors include forcing oneself to throw up, over-exercising, and using diet pills and laxatives. Both binging and purging behaviors are dangerous, and together they can quickly lead to dangerous physical symptoms. Muscle dysmorphia. Unlike most types of eating disorders, muscle dysphoria tends to affect more men than women. The disorder is characterized by a disruptive obsession with musculature and physique. The individual will fixate on obtaining the perfect form of musculature. Binge eating disorder. Binge eating disorder is characterized by episodes of binging on large amounts of food. A binge describes when someone consumes an excessive amount of food within a period of 2 hours. Binges are accompanied by a trance-like state, feeling guilty and ashamed afterwards, and weight gain. Unlike bulimia, BED does not usually include any purging behaviors. Typically, those affected by BED are overweight or obese because of the binging. Other specified feeding or eating disorder. OSFED is a catch-all for types of eating disorders that don't fit into the above categories. Doctors and psychologists will often diagnose those with atypical anorexia or bulimia, as well as the following 7 unofficial diagnoses with OSFED. Unofficial eating disorder. Compulsive overeating. This disorder is similar to binge eating disorder. What makes COE unique is that the individual doesn't binge in spurts, but rather eats large amounts of food all day long. Prater-Willi syndrome. This syndrome, which leads to compulsive eating and obesity, is caused by an inherited genetic disease. It begins with weak muscles, poor feeding, and slow development in babies. Then, in childhood, the disease causes insatiable hunger. Children with Prater-Willi syndrome often develop diabetes and struggle to adapt to a normal lifestyle. Diabolia. This occurs when someone who is diabetic. Orthorexia nervosa. We are all under pressure to eat healthier for various reasons. In the case of orthorexia nervosa, someone becomes so obsessed with planning a perfect diet that it disrupts their life. Selective eating disorder. This eating disorder is a bit like picky eating, but at an extreme, debilitating level. An individual is so selective about their food, usually sticking to 1 or 2 meals, that they become sick. Drunkorexia. With a slightly crass-sounding name, this term describes an eating disorder that is accompanied by alcoholism as well. The drunkorexic individual restricts food and purges in order to save calories for drinking alcohol. Severe malnutrition can develop when drunkorexia goes untreated. Pregorexia. Since it is fairly common knowledge that pregnancy leads to weight gain and other bodily changes, so most women go into pregnancy with a weight loss plan. Sometimes the weight loss plan can be too extreme and can endanger both mom and baby. Pregorexia can lead to low birth weight, coronary disease, type 2 diabetes, stroke, hypertension, cardiovascular disease risk, and depression. Treatment may involve a combination of different types of therapy, such as cognitive behavioral therapy. This type of psychotherapy focuses on behaviors, thoughts, and feelings related to your eating disorder. After helping you gain healthy eating behaviors, it helps you learn to recognize and change distorted thoughts that lead to eating disorder behaviors. Family-based therapy. During this therapy, family members learn to help you restore healthy eating patterns and achieve a healthy weight until you can do it on your own. This type of therapy can especially be useful for parents learning how to help a teen with an eating disorder. Group cognitive behavioral therapy. This type of therapy involves meeting with a psychologist or other mental health professional along with others who are diagnosed with an eating disorder. It can help you address thoughts, feelings, and behaviors related to your eating disorder, learn skills to manage symptoms, and regain healthy eating patterns. Therapy may last from a few months to years. It can help you to normalize your eating patterns and achieve a healthy weight, exchange unhealthy habits for healthy ones, learn how to monitor your eating and your moods, develop problem-solving skills, explore healthy ways to cope with stressful situations, improve your relationships, and improve your mood. Medications for eating disorders. Medications can't cure an eating disorder. They're most effective when combined with psychological therapy. Antidepressants are the most common medications used to treat eating disorders that involve binge eating or purging behaviors, but depending on the situation, other medications are sometimes prescribed. Taking an antidepressant may be especially helpful if you have bulimia or binge eating disorder. Antidepressants can also help reduce symptoms of depression and anxiety, which frequently occur along with eating disorders. You may also need to take medications for physical health problems caused by your eating disorder. Take an active role. You are the most important member of your treatment team. For successful treatment, you need to be actively involved in your treatment, and so do your family members and other loved ones. Your treatment team can provide education and tell you where to find more information and support. There's a lot of misinformation about eating disorders on the web, so follow your treatment team's advice and get suggestions on reputable websites to learn more about your eating disorder. Examples of helpful websites include the National Eating Disorder Association, as well as Families Empowered and Supporting Treatment of Eating Disorders.